Well, as they seek to find new cost savings in medicine, Democrats on Capitol Hill plan on shifting more control over health services to a so-called medical advisory council. Basically, government bureaucrats who will decide what products and services are essential for you and which ones are not. So is that the government getting between you and your doctor, and is it appropriate? Joining us now for a fair and balanced debate, Fox News medical contributor Dr. Mark Siegel and Dr. Oliver Fine. Dr. Fine is the president of Physicians for a National Health Program and also a professor of clinical medicine and public health at Weill Cornell Medical College. Good morning, doctors.
Good morning.
Good morning.
I don't know about you, Bill, but I feel safe on this set this morning. Look at all the doctors we have available.
Give us some advice, guys.
Okay, so this is getting more and more attention, this medical advisory council that's been proposed by the Senate. There's a similar proposal in the House, but the one in the Senate is rather controversial because its recommendations, according to the reports, would be binding. So these bureaucrats get together, their recommendations are binding on what's efficient and what's not. And then you, doctors, some say you have the decisions taken out of your hands on what's good for your patients. Dr. Siegel, do I state the facts correctly as you know them and your feelings on it?
I like how you are putting it, Megan. And the truth is, not only does doing this take the decisions out of my hands, which, by the way, medicine is an art. It's a one-on-one doctor and patient deciding something. Nobody in Washington, no bureaucrat can make those decisions for me. But you know what they won't take away from me, Megan? They won't take the liability away. I mean, look, they're going to make the decision of what I can order, what I can't, whether my patient gets an MRI, whether he doesn't, more and more restrictions to cut down on costs, decreasing reimbursements to me. All of this is insurance. It's not about health care. And in the end, I'm going to get penalized. And we already have a problem with doctors dropping out and not enough primary care doctors. That's going to worsen under any government control system.
Dr. Fine?
Well, we at Physicians for a National Health Program believe that the real problem is with the private health insurance industry, not with the Medicare program. Medicare is our one single-payer program, and it has the highest satisfaction, actually, among insurance programs.
Let me just jump in, because I'm not sure I understand you. They're talking about creating this medical advisory committee that would be advising not just Medicare recipients, but others, as far as I understand. It would be this program that would at least oversee the government-run faction of the health care program. And so the concern is that doctors who are taking patients under that would be forced to do what the council thinks is right as opposed to what they think is right.
Well, you know, we would have, I think, as physicians, more input into that kind of a council, frankly, than we do in the setting of private health insurance, where, frankly, we as physicians have very little control over what happens in a private health insurance industry and what they say they're going to cover.
I completely disagree with that. I think I've talked to Dr. Fine offset. He's a very nice guy, but this is hooey. I'll tell you why. Because we don't have enough control now. Giving it to the federal government, then we have zero control. He's right about one thing. With negotiating with insurances is difficult. We have to do it on a case-by-case basis, but at least we're sitting there with the patient making these decisions and then trying for approval. We're going to end up with those waiting lines because he's going to put this together. This idea is going to go together with the public option. And we're going to get rationed care. We're going to get long waiting lines the way we have in Canada already. I looked on the British Columbia website, Megan. They say in an emergency you can get your surgery right away, but you look past that line and you see 16,000 people waiting for hip and knee replacements. Who's deciding whether something's urgent or not? Not the government. Got to be me and the patient.